Hello, everyone, and welcome to my channel Study Nursing by Sense Goals. Today, in this video, we are going to discuss about a nursing care plan, which is pain. Pain is the most commonest nursing care plan which we can find anywhere. So, I have taken this particular nursing care plan for the video. But if you have anything that you wish to learn, please let me know in the comment, and I can try my best to include that care plan in the upcoming videos. Um, and before we go ahead, I would also want to discuss with you a couple of things. So, when it comes to care plan, please understand that each patient is different, each scenario is different. Hence, it is very important that you do not blindly follow the steps which I am discussing. Instead, you understand and acknowledge and try to fit them those instructions which I'm discussing with you, and also not instructions, but the couple of tips and couple of methods and interventions which I'm discussing in the video. Try to embrace them and modulate or adjust in such a way that it fits in with your plan of care. So bottom line is, please do not blindly copy. Instead, try to make it adjustable with your care plan so that the patient you're caring for gets the desired outcome. All right, so without much ado, let's move to the first step of nursing care plan, which is assessment. If you have seen my previous video, you would be able to know the different types and steps of nursing processes and what are they intended for. If you haven't, I would advise you to go ahead and watch a short video which I have made on introduction to nursing care plan. And once you have done with it, come back to this video and you'll be good to go ahead with it. So in assessment, we have the subjective data. So what would be the subjective data for a nursing care plan of pain, somebody having pain? So they can tell you that they have pain on their whatsoever location. So for instance, I have written one of the subjective data as I have pain on my neck. So that becomes my subjective data. And going on to the objective data in it, I'm doing a couple of observations to rightly assess my patient. So my observations or assessment begins with of course, the primary problem, which is pain. In the pain, I would assess a couple of things again, which is a severity. I would assess it with a behavioral pain scale, or in your situation, you can always depend on your organization or your school's policies where they are using particular pain scale for assessing the pain. So that is one of a tool to assess the pain. All right, and you can also assess the characteristic of the pain, which is where the pain is located, how long is the pain, what is the nature of the pain, is it a constant one, or is it a stabbing one, or a throbbing one, or a severe dull? So all these assessments could be made in the first place when a patient complains of pain. And what could be the next observation you could go for? You could look for the site of pain for much more information, such as, is there any color change, such as redness? Is there any edema or swelling in the site? Any presence or absence of bleeding? Any abnormal sensations, such as numbness or excessive heat feeling or excessive coldness, etc. So once you have observed the site for all these, make sure that you're writing and documenting or recording it in the care plan as well. And now that you have done with the observation, which comes in the assessment section, okay, you're going for a monitoring. What are the couple of things that you would monitor for a patient having an active pain? You would go for a pain scale. All right. So once again, I would urge you to refer to the scale which is followed by your organization or the school. So this is one of a simple scale which you are seeing now. So 0 means no pain and 10 means worst possible pain. So if the patient can verbalize, he can show the scale and let the patient score himself or herself. Otherwise, you can also observe the patient's face, and then you can rate them in the pain scale. The second one is, remember I told about the abnormal sensation, especially when the patient has pain associated with the fall or any of the injuries. Say, sometimes they have altered consciousness. So we can use neurological observation scales such as Glasgow Coma scale. Once again, refer to your organization policies or school policies, what your teachers or what your supervisors or managers or even the organizations suggest you to refer and assess. So, as per those rules and policies, you can use such tools. And most importantly, the vital signs, which is crucial indicators of how the pain is progressive. For instance, in a severe pain, you can see elevated recording in the vital signs. So you monitor that as well in the assessment. And as I've told before, you monitor or assess the site for any bleeding or any burning sensations or numbness. Especially when, say, in the case of a neck pain or a neck injury, your patient is in acute pain. If the pain is so much so that the patient has difficulty in swallowing or taking up food or fluids, that might lead to further complications. So it's important as a nurse, you should assess all these things and make sure you record them. And now that we have discussed about the assessment, which has subjective data, objective data, and then you monitor a couple of things, you are now going on to the goal. So what would be your nursing goal, or the nursing intervention or the nursing process goal would be, the patient experiences relief from the pain in an hour. So I am being smart in here. So if you remember, if you have watched my previous video, we discussed about formulating smart goals, that is specific and time oriented measurables. There are certain things in it. So I have prepared a smart goal which says at the particular time and how I would wish my patient to be. I formulated a goal according to this. And let's move to the intervention I would like to make for the patient in pain. So, my first intervention would be to immobilize or make sure that the pain area is safe, because in case of some fractures it might not be advisable that the patient moves, and that creates much more pain or worsens the situation. So rationale behind the step number one would be immobilizing the affected area to bring relief to pain or bring down the pain or to avoid complications. So the second one would be to elevate and support the affected area. This also has got the rationale of bringing down the pain or to avoid progression of the pain or to provide comfort to the area or bringing down the pain. All right. So we can elevate or support the area. And the next one would be to suggest as well as supervise the range of motion exercises, be it active exercise or the passive exercise. Once again, I would encourage you to go into your patient specific mode, where you are analyzing, okay, is this point to be included in my patient or not. For instance, if you are doing a surgical care plan where your patient has got pain, where ambulating or mobilizing your patient can bring down or improve the patient's pain a bit. For instance, he or she had a hernia surgery, and then they are starting for further ambulation and ambulatory care. You know what I mean? In that case, you can suggest these exercises, whereas you cannot really go ahead and suggest these exercises for a patient who had an open heart surgery recently, right? So it depends, but my intention is to give as much point as you want in a care plan with a patient who has pain. So that is one of the point that I have added. And the fourth point is of a comfortable position. Many times we can underline the importance of this particular, yet I would consider a treasure point. This is especially applicable in case of elderly patients, and when they are in pain, offering comfortable position will have a great positive impact, including the prevention of pressure ulcer. So check in detail regarding this point and make sure you provide comfortable position to the patient so that they feel much comfort, and also they experience less pain. And the next nursing intervention would be to provide position changes. Again, I would advise all of you to have a look at the patient and your case, and according to that you can include or exclude this point. There might be situation where, especially in the elderly, once again, or even any vulnerable patient, where the position changes can bring extreme comfort, or great comfort. That would be the right adverb to choose. um, Great comfort from the and they would be free from pain if you do so. So depending on 2 hourly or 4 hourly position changing, you can implement those actions to bring some relief to those pressure areas, if it's applicable, I'm saying. So now that we have seen these many nursing interventions, I will take you through other intervention as well. The first one is investigation such as X-rays or CT. So you can help the patient get ready with them, and medical management include, for instance, if your patient has acute pain associated with ascites, they can tap the ascitic fluid, right? And in that case you can assist in those medical procedures. This is what I mean by the term medical management. You can also add points such as administering the pain medications as per order, depending on the type of case or the patient that you get. So these are the other interventions that could also be added onto your nursing care plan. What would be the evaluation looking like? So by the end of an hour, my patient's pain is reduced as evidenced by a reduced pain scale of so and so and improved vital signs. So in the evaluation, you can write the evidences depending on the tools that you have used to monitor or assess the patient. So I hope you understood this. I'll give you a quick sample of a scenario so that it become much more easier and simpler for you if you were not able to catch up with me until now. So yes, we have seen all the 5 steps of nursing care plan in the pain area. But I would like to take you through a sample care plan. So this is my scenario where a 45-year-old male named Alex is admitted in my ward with severe head and neck pain following a fall from the bed. I go and assess my patient. I introduce myself and I start my assessment. My subjective data would be Alex telling me that I have severe pain on my neck. And I observe a couple of things and I'm jotting down my objective data. There could be more, but for the sake of giving you an idea of how it would look like, I'm presenting this likewise. So behavioral pain scale of 8 by 10, where when I assess my patient, and my patient Alex has a dull pain which is constant in nature with no swelling, uh, but oh, okay, I have written a smile swelling, sorry, excuse me. So this is my objective data that I have prepared, the bps of 8 by 10, and I've added the characteristic of my pain, of his pain, and also how the site looks like, and how much tender it is to touch. And I've also added mild swelling, that is observable. I've also added a sample vital signs which might indicate he is in pain. And it's also important that you check the baseline of the patient. Sometimes the patient can have a baseline of high BP and high heart rate, and any existing condition that can cause the same vital signs. So you cannot conclude that this is only because of pain that my patient has elevated, values. So in this case, I believe Alex has otherwise baseline, values which are much lower, but at present he has got a much higher values when it comes to observation. So I have assessed Alex, and based on that, my diagnosis is acute pain in the neck related to fall, as evidenced by behavioral pain scale of 8 by 10, abnormal vital signs, and verbalization. You can even rewrite as acute pain in the neck related to fall, as evidenced by verbalization, in and the values such as BPS of 8 by 10 and elevated values in the vital signs. So this is my nursing diagnosis. And moving on to the intervention, I would monitor Alex for the size, the characteristic of the pain. I would look for any signs of worsening, any symptoms of worsening. I would also monitor his vital signs. And since he's a case of fall from the bed, I would also look for the alertness, and I would also monitor him for orientation as well, whether he is oriented, whether he is conscious, etc. My interventions would be to provide suitable mobility for him as per the order. Since it is neck and head, I will check with the other professionals, that includes doctors or consultants or physios, whoever is available at the unit, for the appropriate mobility. I would also check with them for positioning. What would be the ideal position that I could provide to my patient so that he feels supported? At the same time, I would also consider hot and cold compress, but this is a gray area where we nurses have to be a bit aware. Make sure that you have the order, because otherwise the cold compress and hot compress might be contraindicated in a couple of cases. So make sure you discuss with them and you have a written order for that. And I would also prepare him for an investigation if ordered. For instance, an X-ray or CT scan. Would check if there is any order for the blood sample. If so, I would take the blood, send it to the labs, and I would also chase the result and escalate it to the doctor. I would also go for any of the medical management, pharmaceutical management, that includes any pain relief. And it is also important that pain is strongly associated with the psychological factor also. So it's essential that you keep your calm and provide some emotional support and psychologically available for the patient, if you know what I mean. That intervention is also quintessential for the pain management. So now that, even though I have not included, you can take them as valid points. So now that we have done everything, we'll move on to the evaluation. So in my case, I'm just writing within 40 minutes, Alex pain is reduced as evidenced by verbalization, and also I am providing some more evidence to support my care. So this is what we call as evidence-based practice. So this is what the evaluation would look like. So in the comments, let me know if you can think of any other points which you have implemented in the nursing care plan of a patient with pain. That ways we are helping each other learn in a better way. But always remember, as I've told, this is just a sample that I'm sharing with you, that you can use in your daily care plan. And do let me know how you felt after watching the video, how confident you are. With that, I would like to end the video. Please feel free to subscribe the channel, check out the rest of the videos, and continue to enhance your knowledge and become a confident nurse. All the very best, and thank you so much for your time.